My name is Daniel Hanawat Morales. I work as the Vaccine Planning Branch Director for the Grace Harbor Public Health Department. I've been doing this for a few months already, and like most information, it changes on the daily. So it's really hard to keep up. Luckily, I like to read. That's one of my hobbies, and so I don't get burdened there, but I did lose my glasses, so that's been difficult. But with that being said, I did want to highlight that there are new variants of the COVID-19 that have been found in 12 different states in the United States already. And the reason why that's important is because it's shown that they have, the transmission rate is just so much higher than it has been in the past. So these next few months are really going to be critical to us protecting our loved ones and utilizing the tools that we have been given. So that includes, making sure that we continue to wear a mask, that we stay 6 feet apart, that we avoid crowds, and that you get vaccinated as soon as possible. So as you can see, it says the new variants that spread more easily could lead to a rapid rise in COVID-19 cases. Now more than ever, it's important to slow the speed. In the US, new cases are the highest ever and rising. Some healthcare systems are at or near capacity, which is very true for our county. And new variants are emerging that spread more quickly. So more spread equals more cases, which results into more deaths. And so this is very serious for all of us, but in particularly these particular populations that you serve, because they find themselves in congregate settings, or with healthcare workers, or attendants, or home care aides. And I know that increases the anxiety for a lot of people. But I do want to at least address it because I want you all to continue to be safe. Continue to practice the measures that you have been using. Now more than ever, it's extremely important. So with that being said, stop sharing the screen, but I also wanted to talk about the COVID-19 vaccine. mRNA is a new technology. It's a new in vaccines, but it's been studied for over 40 years. And so it's important to understand that mRNA does not impact DNA. M actually stands for messenger, so it's messenger RNA. The messenger RNA is the counterpart to DNA. So DNA is a very solid structure that provides the codes for life. mRNA or messenger RNA is the part that actually gives messages to the cells on how they're supposed to respond and carry out specific functions. And this is very important. So basically what scientists have done is taken the genetic code of the actual COVID-19 virus and recreated a piece to synthesize mRNA, and that communicates with the cells to create antibodies. So in this vaccine, you're not going to encounter the virus. You're not going to get COVID-19. This is just like you have a diamond and a synthetic diamond. The synthetic diamond is made up completely by humans. This is what the mRNA vaccines are. So you don't have no live virus, no attenuated virus, no dead virus. And we utilize those kind of viruses in a lot of vaccines like the flu or polio or yellow fever. So all of this carries pieces of the virus, even though they're dead and sterilized. But when it comes to this mRNA technology, it's utilizing a completely different approach to build antibodies in the cell. And ultimately, it's been so effective that we are able to see, it's been like 94% effective in rising the antibodies within people who take the vaccine. So this is very promising. It's new, it's different. It doesn't take the amount of time. Typical vaccines are, because they require a piece of the actual virus, they're incubated in eggs for months on time, then they're sterilized. So the development process is months to years. But this vaccine, since it's made inside a lab, you can create them within a month. And so you can see 20 million doses created in a month in comparison to actual other vaccines that take months to years to be complete. So this helps us with being able to speed the process along. In addition to that, just the way that the vaccines are made. Instead of completing one stage and going to the other, going to the second, and waiting for the second to be completed before you go to the third, all of these phases are done concurrently. So 1, 2, 3, and 4 are happening at the same time. This also influences the rate of production. And so this is very promising as we are seeing that new variants are arising and we need more vaccines faster. I'm sure all of you have heard at some point that the state isn't getting as many vaccines as they would like. Lines are being long, people are getting turned away. And this is not really anything that we pride ourselves in promoting as a county, but we do hope to be honest and truthful that when we don't get the vaccines that we requested, that we at least communicate with the public. It doesn't do anything to quell your fears about when you're going to get the vaccine, but it does give you an accurate picture of what we're dealing with. So with that being said, I'm hopeful that in the coming months, with the new vaccines that are getting ready to be approved, like AstraZeneca, we're going to see an influx of vaccines. So even though we're at a shortage right now, and we're not getting what we would like, I don't anticipate it to stay that way. And so I'm hopeful there because there are a number of vaccines still being produced. So Pfizer and Moderna are not the only vaccines that we created differently. So it won't be 2 doses, it'll just be 1. And so that's going to influence the number and the time. So we can do everybody with Moderna, but scheduling for 28 days later influences the capacity we have to vaccinate people.
Sure.
When we get to AstraZeneca, it's 1 shot, you're good to go. We don't have to call you back 28 days later. It's a lot more stable. So you don't require the ultra cold chain requirements or ultra cold storage requirements. So it's just a lot more, it's a lot more efficacious when it comes to dealing with mass numbers of the population. And the contract that we have is for a lot more vaccines in comparison to Moderna and Pfizer. So that's another promising results of that production.
So where is is there a timeline for when that one will be released or?
They're looking at in a few weeks, it's supposed to go for approval. And so that's very promising. And so I'm really hopeful that even though all these new variants are coming out, that in the near future, not February or March, but hopefully between March and April, we will be able to see another vaccine being put into people's arms across the nation. The studies that they have done have not included children. So for Pfizer, no one under 16 was given a vaccine. No studies have been done. And for Moderna, no one under 18. And so when it comes to vaccine eligibility, children under 16 for Pfizer will not be able to get the vaccine. And people under 18 for Moderna will not be eligible for the vaccine. That's not to say they're not working at getting those studies done, but as they push through with the emergency use authorization, they were not able to grasp that piece. But they did do studies on people with diabetes, hypertension, cancer. A number of diseases and comorbidities were actually, they made sure to cover those within the studies. And there was no effects that would say that they shouldn't take it. So the benefits still outweighed the risks. That was something that they brought up on a call this week, that recent studies show that if you're vaccinated, you had such a high rate of antibodies, even afterwards, that they no longer believe that you can transfer COVID. That's still in preliminary stages though. And before, what it was is they really didn't have no studies to show how people responded afterwards over a sustained period of time. And what they've come to show is that the antibodies in somebody who were vaccinated lasted longer and had a much higher uptake than people who had immunity from the actual viruses. I made sure to tell people prior that just because you're vaccinated doesn't mean that you cannot transfer it. But this week they put out some new guidance that it's much less likely to transfer once you've been vaccinated because you have a higher level of antibodies as a result. Okay, so I'm gonna go down one of the questions that I have. It says, how can people find out when they're eligible to receive the vaccine? Recently, the Public Health Department has put out a vaccine intake form. And so this intake form will ask you a series of questions. And those questions, based according to your answers, will put you into a specific phase. And that phase will tell you when you should be available to get the vaccine. Right now, we are still only vaccinating for 1A with plans to start vaccinating for 1B as soon as possible. But we are working to create opportunities for mass vaccination clinics so we can vaccinate a large portion at a time compared to only 100 people once a week. And so I'm very hopeful. We do have a large list at the health department, so I recommend that as soon as you can call down to the resource center and they'll walk you through it. It's also on our website, but for those people who might have difficulty in understanding the processes, I recommend that you call the call center and let them register you. And eventually what will happen is when we're ready for the vaccine clinic, we'll reach back out to you and provide you a link to schedule the time and date that you want to come in to be vaccinated. I really like the new intake form that we have. It's streamlined. You can have an answer in 15 minutes and it puts you in line. And that's something that I think people have been waiting for. And at the very least, at the end of it, they will know what phase they've been assigned to. Find Your Phase will do, it's a Washington State version, but what they do is they take your contact information. At the end, they send us your contact information. And then we send you an intake form. It can be a little confusing sometimes, but I do want you to know that if you do find your phase, we will get that contact information and we'll reach out to you with the link and ask you to complete that. But if that process begins to be too cumbersome or confusing, feel free to call the resource center and they'll walk you through that directly. So the second question says, how will people who have barriers to technology, such as limited or no access to broadband or a device, or who are unable to access it due to their disability, be notified that they're eligible to receive the vaccine? While I wish this was perfect, and I know we have a call center, that doesn't mean they're necessarily going to be notified. And this is where our partners are crucial to share the message as gatekeepers that there is a way they can get put on the list. Our call center can walk them through that step. They do have translators. But if you know somebody who's out there and needs help, please don't hesitate to send them our way or even to walk them through it. You can help them fill out the vaccine intake form online and help provide some of that structure that they need. But you can also call us and we can, if they need, actually send them an actual hard copy reminder to a physical address with where the location and immunization can be done. So the next question is, are there plans to help provide with transportation or some sort of mobile vaccine unit to reach individuals and families with transportation difficulties? I wish I could say at this time we had something in place, but we don't. Am I trying to get something in place? Yes. But anytime we move or propose new ideas, it takes some time. And so I really, again, would stress that it's so important that as a village, we really take care of the entire population and not just the ones that we're closest to. So I am in works with different organizations, and there are opportunities as more vaccines are distributed to really step out the box and make sure that everyone's vaccinated. With that being said, Safeway and Harbor Drug They are two of the retail pharmacies that have begun to have their enrolled providers for the COVID-19 vaccine. So in addition to that, the community hospital, Summit Pacific, and CMAR are also enrolled providers. Right now, we have 14 enrolled providers in the county. Are they all getting vaccines? No. And that's just due to the number of allocations. And I want to say we only get about 4,000 vaccines a month. And I say that so that you can try to understand the pace and speed that we're going at. It's really difficult to reach all the rural communities when we have so little vaccine in hand. And we don't get, they don't tell us you're going to get 4,000 vaccines this month. They tell us weekly how many vaccines we get. And so it's really hard to pinpoint specific populations that we can target when we don't get that information, except for a week at a time. And so it's a scary time. But with that being said, I do anticipate that as these more stable vaccines are released, we are going to be able to see things like that, where these local retail pharmacies are going to be able to visit and provide vaccinations at a greater number. But as they're barely being released and we're still fairly new to the actual cold chain requirements, we see the difficulty in distribution on the daily. It definitely doesn't make it easier, but I think that some of the goals are by the end of summer, we can have a majority of the population vaccinated, or at least a vaccine available for them to get the regular community at large by then. I would say that if they're all vaccinated, it does provide a safer measure. However, due to the variants that are out, it's still recommended that even once vaccinated, you maintain the 6 feet, you wear your mask, you wash your hands until a majority of the population has herd immunity. So at least 70% of the population has been vaccinated. It's a lot. It's a lot for all of us to take in. We've been doing this for a year. New vaccines have come out, new presidents. It's a lot. It's an emotional roller coaster for anybody. And then not to include the things that we go through, the changes, the grief that we experience from being in these different situations and having to let go of so much that we're used to. Vaccine intake form that when you fill it out, you copy the link and you share it with everybody you know. And so that they can fill it out, so they can see there is a way that they can access and they can understand. Communication is power. If we get them on board, they'll get vaccinated sooner, and we can get closer to that herd immunity that we're all really trying to do. That's really why we did it, is so we can start getting a count and understanding how many people want the vaccine. Because of the cold storage requirements, we try not to waste one, because we look at every single vaccine as a life-saving measure. And so it's important that when we set up our clinics, that we know the exact count and that not one person misses their appointment. So it's a lot. And this is why the carry out of the distribution has been so difficult, because it really is, it's not just a vaccine. It's a new technology that has different requirements that can be fragile if shaken. It has to be stirred, not shaken, and there's things like that that we really have to pay attention to. It can only be outside for so many hours. It has to be maintained or outside of the light, and some you can have in the light. So there's just a lot of nuances of the vaccine that we have to protect. But as new ones come out, we can see greater stability in the vaccine itself. And so it'll be an easier access for multiple populations once we get there. So the next question I have on here is, one of you asked it, can you still spread COVID once you have the vaccine? And just for clarity, it's thought that you have a greater chance of not spreading it after your second dose, once you've been completely inoculated. Just the number of antibodies in your system, it stays high And they're still working on those studies, so it's not set in stone, but it looks very promising that you will be protected against spreading that to your family and loved ones. So the next question I have is, why do people need to have 2 qualifying conditions to be eligible to receive the vaccine? Especially when conditions such as Down syndrome are known to cause higher rates of severe disease, even without a comorbid condition. Very good question. Not necessarily my favorite question either, because it required a lot of research and a lot of pushing to get an answer that they weren't necessarily ready for. But studies show that people with Down syndrome do have a greater risk of suffering under COVID-19 in a way that is comparative to people with comorbidities, if not even worse. And so when you brought this question forth, I reached out, I did the research. It is true. And then I reached out to our health officer and said, look, we have a problem. Down syndrome is not listed on here until tier 4. It's not even listed on here at all. Wow. And that's not an equitable approach. They are more susceptible, they are more in danger. And just the way they laid the guidelines out, it does not protect people with Down syndrome in an equitable way due to their underlying conditions. And he said, you know what, you're right. He said, you're right. And this is why it's so important that you continue to ask these questions, because there are some things that we overlook. But to be clear, we don't set these phases. The Department of Health does, and we do our best to follow within those guidelines. But when things like this come up, we also try to mitigate that, because we do believe in equity for everyone. And so as a result, we have bumped people with Down syndrome up to their...
Hey, that's awesome. Daniel, that's amazing.
It is. I was pretty excited because our doctor understood that. And we don't really try to fight against the health department, because they ultimately provide us guidance. But as a local health jurisdiction, we can make some calls when we feel like there's some things that are not being addressed. And based off of those phases, we felt like Down syndrome was not being addressed the way it should be. Or people with Down syndrome were not being addressed in an equitable manner at all. And so we have created, as of today, we have changed our survey intake form to include people with Down syndrome and being able to automatically put them at a closer phase than tier. It's important. They're important. You know, we can't just ignore the reality of what they have to go through. And so we don't intend to either as the Grace Harbor County Public Health Department. And I'm very grateful for Dr. Boucher, because he understands where we're coming from. And when I present these things, he said, you know what? That's a good question. He really encouraged that y'all continue to bring these things up, because the plan is not perfect. And some things we miss. And when we're heard, we will do our best to address those equitably.
Thank you. Thank you very much.
So we heard you. I do want to say that.
Cool.
So the other question is, will the vaccine cost money? No, it will not cost money. These vaccines were produced off of public funds, and so they will not cost money. Now, some of the places they've been okay to charge an admin fee, but typically they bill that to the insurance. They shouldn't charge you directly. But places like Safeway, they have the vaccine for children and vaccine for adult program. So if you don't have insurance, they're not going to request that. Any of the hospital systems are not requesting it. And as we do mass vaccination clinics, we are not requesting any fees during those times either. So we're really trying to be equitable and ensure that nobody has to pay for something that can save their lives just because they have to go to work. You know, that's not okay. We're all under a lot of stress. It's not okay to add an extra fee on top. The other question I have are parents who are caregivers for their medically fragile children eligible to get the vaccine in 1A. This is another hard question. Unfortunately, I was not able to get the answer as I was able to for people with Down syndrome. And the reason for that is the transmission and the societal impact and the overwhelming need for children or people with Down syndrome. The population is nowhere near as large as parents who are caregivers to their children. And so with just, if you just take into account that we as a county get about 4,000 vaccines a month, that would really impact the rate at which we could distribute the vaccine. But if these parents have comorbidities or these particular situations, they're 70 or above, or they're critical workers, they can get vaccinated. So it's not a perfect answer in any way. Our distribution allocation process is not perfect in any way. And as well, we have such limited vaccines, unfortunately, we have to do our best to try to have an equitable approach for everyone in the community. And so it definitely is, it can be uncomfortable for a lot of people, and I know it is. But my understanding of that is they can fall under the various tiers of 1B, which we are in as of now, but they're not qualified as 1A. You know, really highlight that this is a slow distribution effort because we really do want to be as equitable as possible, all the while maintaining our societal structures and our hospital capacity. So there's so many factors and facets. And then, you know, when the distribution says, oh, you're not going to get that many vaccines this month, everybody's for a loop. And then people get upset. And that's totally okay and honest and real. But it definitely can have an impact on the trust that the community is giving to the people who are distributing the actual vaccine. Right. So it's a hard place for a lot of people. So I try not to, you know, be quick about that answer because I know that there's so many factors that influence or what people are actually going through in their home lives right now. But on the actual intake form, when you get to that point, it provides you with the link to the CDC that highlights all of the medical conditions that fall underneath that. On the Washington State Department of Health, I try not to refer too many people to the CDC because the CDC guidance is not necessarily the phases that the Department of Health has produced or announced. And to be honest, I do believe that the Department of Health provides a more equitable approach and understanding and education compared to the CDC. And I hope that over the next few months that will change. So I always recommend people to utilize either source. But DOH is typically the way I go to all of those. But if you go to the Department of Health website and look at the phases, there's an infographic that actually details all of it for you and gives you a better understanding of what they mean when they say comorbid. Specific illnesses and diseases, when combined together, cause a greater effect on the health. Just to say at the end, we are planning mass vaccination clinics for the month of February. So it's really important that you get your name on that list. We won't be able to get everyone in the month of February, but our goal is to get as many people as possible. And so that'll just be the start, and we hope to continue that throughout the months that follow. So please keep an eye on that public health page and our social media page, and we will share information as it comes out with Christy as well.